There's a looming public health crisis in California. Our state's most vulnerable populations stand to lose access to life-saving medicines because of a bureaucratic state decision made by former Governor Jerry Brown's administration that takes effect on May 31st. If implemented, it will prevent community pharmacies from providing vital medicines for Medi-Cal patients. What does this mean for California? Our most medically fragile Medi-Cal beneficiaries, roughly 3 million people, stand to lose access to their essential life-saving medicines, particularly those patients with HIV/AIDS, mental illness, cancer, and those who are in long-term care facilities. The new state rules will bankrupt many community pharmacies, effectively eliminating this important healthcare safety net for California's most vulnerable populations. So, how did we get here? In the summer of 2016, the Federal Centers for Medicare and Medicaid Services adopted a rule to change how pharmacies are paid for dispensing prescription medicines. CMS is requiring every state to adopt new rules to conform with the federal standard, but did not say how states should do this. The new methodology developed by the California Department of Healthcare Services will result in denying life-saving medicines for Medi-Cal patients. In fact, it's already started resulting in catastrophic reductions to Medi-Cal reimbursement rates for hundreds of locally owned pharmacies in communities throughout California that serve Medi-Cal patients. And what's worse, it's not just forward-looking cuts either. DHCS announced it's collecting 2 years of retroactive payments from community pharmacies that currently serve Medi-Cal patients dating back to April 2017. California can and must do better. Californians for Access to Life-Saving Medicine is asking Governor Gavin Newsom and legislative leaders to suspend implementation of the Brown administration's rule to make way for an alternative solution that protects Medi-Cal beneficiaries and the ability of community pharmacies to fill prescriptions. Together, we can ensure all Californians continue to have access to the medicines they need and stop these rules from going into effect. Learn more at rxfairness.org and join us to urge our state's leaders to do the right thing and protect access to life-saving medicines.